What if I told you that one small habit you already do every single day could be quietly sabotaging your blood sugar? Or saving it? Not a new drug, not a strict diet, not another supplement, just water. But not the way most people drink it. I see this every week in my clinic. Seniors doing everything right, taking their medications on time, eating carefully, walking daily, and still their numbers refuse to behave. If that sounds familiar, stay with me, because what you're about to hear may finally explain why. You've probably heard all the usual advice. Cut carbs, move more, take your medication faithfully. And yet, despite doing all of that, your blood sugar still spikes unexpectedly. Morning readings are higher than they should be. Energy crashes come out of nowhere. A1C slowly creeps up year after year. And the most frustrating part is this feeling that you're failing, even when you're trying harder than anyone else. My name is Dr. Ann Richardson. I've spent decades working with adults in their 60s, 70s, and beyond, managing type 2 diabetes and blood sugar disorders. And one of the most overlooked factors I see again and again is hydration. Not just how much water you drink, but when you drink it, how you drink it, and what your body is able to do with that water. As we age, our bodies change in ways most people are never warned about. Cells become less responsive to insulin. The pancreas becomes less efficient. Kidneys don't clear excess glucose as effectively. But there's another change that almost no one talks about. Your thirst signal weakens. You can be dehydrated without feeling thirsty at all. No dry mouth, no discomfort, nothing obvious. Yet inside your body, your blood becomes thicker. Glucose becomes more concentrated, and insulin struggles to do its job. Even mild dehydration can raise blood sugar by 10 to 15 points. That's not theory, that's physiology. And for someone already on the edge, that difference matters. I remember a patient named Gerald, 68 years old, disciplined, meticulous, same breakfast every day, same walk every morning, same medication timing. Yet his fasting blood sugar was unpredictable, and his A1C kept rising. When I asked him to walk me through his morning routine, something stood out immediately. He went nearly 9 hours without drinking real water. Coffee first, food later, water last. We didn't change his medication. We didn't change his diet. We changed when and how he drank water. Within weeks, his morning readings stabilized for the first time in years. And Gerald is not unique. He represents thousands of seniors quietly struggling, thinking the problem is willpower or discipline, when in reality, the foundation is missing. Here's what's happening inside your body when hydration is off. Blood is the delivery system for glucose. When you're properly hydrated, glucose moves smoothly into cells where it's used for energy. When you're dehydrated, blood thickens, flow slows, glucose stays trapped in the bloodstream. Insulin has to work harder, sugar rises. Most people make 3 critical hydration mistakes. They wait until they feel thirsty, they drink too much at once instead of spacing it out, and they drink ice-cold water at the worst possible times, especially in the morning and around meals, when insulin needs free circulation. Your body absorbs water slowly. Dumping a large glass all at once doesn't hydrate your cells. It overwhelms your system and sends most of it straight to your bladder. Small, consistent intake is what actually changes blood chemistry. This is why timing matters more than volume. The single most important hydration moment of the day is the first 20 minutes after waking. After 8 hours without fluids, your body is already behind. Cortisol is high, the liver is preparing to release stored glucose. If you start your day dehydrated, your blood sugar spike is almost guaranteed before you even eat. That's why I recommend warm water first thing in the morning, before coffee, before breakfast. Warm, not cold, because warmth keeps blood vessels relaxed and insulin mobile. Adding a tiny pinch of natural sea salt provides minerals your cells need to actually absorb that water. A small amount of lemon supports glucose stability and digestion. This simple routine alone has helped patients reduce morning glucose readings by 20 to 30 points. And this is just the beginning. Let me ask you something that almost every senior with diabetes has experienced at least once. Have you ever eaten the exact same meal on 2 different days, measured the same portions, followed the same routine, and yet your blood sugar behaved completely differently? One day it's reasonable, the next day it spikes for no apparent reason. That inconsistency is one of the most emotionally exhausting parts of managing blood sugar, because it makes people feel powerless, like their body is unpredictable, broken, or no longer responding to logic. What most people don't realize is that hydration timing is often the invisible variable driving those fluctuations. By the time most adults reach their 60s and 70s, the body's internal signaling systems are not as sharp as they once were. The digestive system slows, enzyme production becomes less efficient, circulation is not as strong, and insulin, even when present, has a harder time reaching the cells that need it. When hydration is inconsistent, these challenges compound each other. Carbohydrates enter the bloodstream too quickly. Insulin arrives too slowly. Sugar rises sharply, and the meter shows numbers that feel discouraging and unfair. This is why drinking water only when you feel thirsty is such a problem. Thirst is not a proactive signal. It's reactive. By the time you feel thirsty, dehydration has already begun affecting blood volume and glucose concentration. For seniors, this delay is even more pronounced because the thirst mechanism weakens with age. Many older adults simply don't feel thirst the way they used to, even when their body desperately needs fluids. One of the most powerful habits I teach my patients is drinking water before meals, not during and not after. About 15 minutes before lunch and dinner, a small glass of room temperature water creates measurable physiological changes. It prepares the stomach, activates digestive enzymes, and slightly dilutes stomach contents. This dilution slows how quickly carbohydrates break down and enter the bloodstream. When glucose enters more gradually, insulin has time to respond. Instead of a sharp spike, you get a smoother curve. I've watched this simple habit transform post-meal readings in patients who had struggled for years. People who dreaded checking their glucose after eating suddenly saw numbers that made sense again. The food hadn't changed, the medication hadn't changed. Only the hydration timing changed. There was a woman named Susan, 70 years old, who came to me convinced that carbohydrates were completely ruining her health. She had cut out almost everything she enjoyed. No fruit, no grains, no occasional treats. Yet even small meals caused spikes. When we reviewed her routine, she drank almost no water before meals. She would sip tea or coffee throughout the day, then drink water only after eating, often ice cold. Once she started drinking a small glass of water before meals, her post-meal numbers dropped consistently within 10 days. She told me, "For the first time in years, I don't feel afraid of eating." Physical activity introduces another hydration challenge that many seniors don't recognize. Walking, gardening, cleaning the house, or even standing for long periods causes fluid loss through respiration and sweat, even if you don't feel hot. When dehydration occurs during activity, blood sugar can swing unpredictably. Some people experience sudden spikes. Others experience drops, followed by rebounds. Drinking water only after activity is too late. The imbalance has already occurred. Small, frequent sips during activity keep blood volume stable and glucose transport efficient. This is especially important for people who experience dizziness, fatigue, or shaky feelings during movement. Often, these symptoms are blamed on age or medication, when in reality, dehydration is amplifying the body's stress response. Consistency is the hidden force that ties everything together. The human body thrives on rhythm. When water intake happens at roughly the same times every day, metabolic processes become more predictable. Blood sugar patterns smooth out. Energy stabilizes. Sleep improves. Many patients report clearer thinking and reduced brain fog after just a few weeks of consistent hydration timing. One man, Robert, 73, had excellent discipline but constant afternoon crashes. Around 3 p.m. every day, his energy dropped and his glucose became erratic. He assumed it was normal aging. When we mapped his hydration, he realized he drank very little water between breakfast and dinner. Once he added consistent midday hydration, those crashes disappeared within 2 weeks. Hydration also plays a critical role in kidney function, which is deeply connected to blood sugar control. The kidneys help remove excess glucose from the bloodstream. When dehydrated, they cannot perform this function efficiently. Sugar lingers longer in circulation, raising readings and increasing strain on the kidneys themselves. Proper hydration supports this natural filtering process, reducing glucose burden and protecting long-term kidney health. Many seniors worry about drinking more water because of frequent urination. This concern is understandable and very common. What most people don't realize is that frequent bathroom trips in the beginning are temporary. As the body adapts to proper hydration, hormone signaling improves and fluid balance stabilizes. Within 1 to 2 weeks, most people notice fewer urgent trips, not more. The emotional impact of hydration changes is something I never expected early in my career. Patients often tell me they feel calmer, more confident, and less anxious about their condition. Blood sugar unpredictability creates constant low-level stress. When numbers become more consistent, that stress eases. People stop blaming themselves. They regain a sense of control. This is not about perfection. It's about giving your body the basic support it needs to function. Water is not a treatment. It's a foundation. And without a strong foundation, nothing else works the way it should. By the end of the 2nd or 3rd week of proper hydration timing, most patients notice that their readings feel less random. Patterns begin to emerge. Good days become more frequent, bad days become less extreme. That shift alone can change how someone feels about their entire health journey. Before we go any further, I want to slow down and say something very important. If you have been living with diabetes for years, if you've followed the rules, taken your medication, restricted your diet, and still felt like your body was working against you, this is not your fault. Aging changes physiology. The system becomes more fragile, and small imbalances create big effects. Proper hydration does not fix everything, but it removes a major obstacle that has been silently working against you. One of the most common questions I hear is, "Doctor, how much water should I actually be drinking?" The answer is not one size fits all, but there is a simple guideline that works for most adults. Take your body weight in pounds and divide it by 2. That number, in ounces, is your baseline daily water requirement. If you weigh 160 pounds, that's about 80 ounces per day. This includes all plain water, not coffee, not tea, not soda. If you are physically active, live in a warm climate, or sweat easily, you need more. Add 1 cup of water for every 20 minutes of sustained activity or heat exposure. Spread this intake evenly throughout the day. Large amounts at once do not hydrate cells effectively. Urine color is one of the simplest feedback tools you have. Pale yellow, similar to lemonade, indicates proper hydration. Dark yellow or amber signals dehydration. Completely clear urine may indicate overhydration, which can dilute electrolytes. Balance matters. Electrolytes matter as much as water itself. Cells cannot absorb water efficiently without minerals. That's why a tiny pinch of natural sea salt in morning water is so effective. It provides sodium, potassium, and magnesium in a natural balance. Processed table salt does not offer the same benefit and should be avoided. Magnesium deserves special attention. It plays a direct role in insulin signaling, muscle relaxation, nerve function, and sleep quality. Many adults over 60 are deficient without realizing it. Taking magnesium in warm water about an hour before bed can stabilize nighttime blood sugar and improve sleep depth. Better sleep, in turn, improves insulin sensitivity the next day. I've seen patients with long-standing diabetes experience dramatic quality of life improvements after addressing hydration and magnesium deficiency. Less nighttime waking, fewer morning spikes, better energy during the day. There was a woman named Dorothy, 74 years old, who had lived with diabetes for nearly 2 decades. Her A1C had steadily climbed despite multiple medications and strict diets. She felt defeated. Her hydration was minimal because she never felt thirsty and disliked frequent bathroom visits. After implementing consistent hydration and mineral support, her readings improved within weeks. 3 months later, her A1C dropped significantly. More importantly, she felt alive again. She returned to activities she had abandoned years earlier. What struck me most was not just the numbers, but her emotional shift. She no longer saw her condition as a losing battle. She felt capable again. This is why I encourage people to try this approach for 14 days. 2 weeks is long enough to see real changes without feeling overwhelming. During those 2 weeks, track your blood sugar carefully. Notice patterns. Pay attention to energy, sleep, mental clarity, and mood. Many people are surprised by how quickly they feel different. This method does not replace medical care. Never stop medication without professional guidance. But when hydration improves, medications often work more efficiently. In some cases, under a doctor's supervision, dosages can eventually be adjusted. That is not the goal, but it can be a positive outcome. If you have kidney disease, heart failure, or are on fluid-restricting medications, speak with your physician before increasing water intake. Individualization is always important. For most people, however, this approach is safe, gentle, and highly beneficial. I want you to understand something deeply. Managing blood sugar is not about fighting your body. It's about supporting it. When you give your body what it needs, it responds. Not perfectly, not instantly, but steadily. If you've watched this entire series, it tells me something about you. It tells me you care. It tells me you haven't given up. And that alone matters more than you realize. I invite you to leave a comment sharing whether you plan to try this method and what your biggest challenge with hydration has been. Someone else reading your comment may feel less alone because of it. Small, strategic changes done consistently create real, measurable results. You are not too old. You are not broken. And it is not too late to feel better. Take care of yourself. This is Dr. Ann Richardson. I'll see you next time.